We've hit 472,000 deaths in the United States. Let's push that number down. And even if you don't believe in masks, wearing them is such a considerate thing to do for those who do. So let's start the show. Thank you again, and please ask questions during the show. We'll try and get to them and bring these issues to our guests. Welcome to the Nonprofit Report, your weekly update on nonprofit organizations, issues, and leaders. I'm your host, Mark Oppenheim. Today, we'll talk about how child welfare services have been affected by the pandemic with guests. Tara Perry, CEO of National CASA, the Association for Children. Barnaby Murff, CEO of Extraordinary Families in Los Angeles. And Larry Rein, President and CEO of Childnet in Florida. So we have the entire country here at our disposal. And a reminder to Zoom attendees that we will take 3 snap polls during the show, and we'll announce results. And questions submitted through the Q&A function at the bottom of your screen will be included in our discussion. So thank you all for joining us from your various locations. Tara, I see your microphone is turned off, so we're going to go to you right quick, because children and youth are some of the most vulnerable members of our society, and you represent children and youth before the court. So if you could just describe the work that you do and the settings in which you operate, I think that would do a great deal to get us kicked off.
Absolutely. Thank you so much. So again, I'm Tara Perry. I'm the CEO of the National CASA GAL Association for Children. We are a national movement of 950 local programs and state organizations across the country. We operate in 49 states. The one state that we are not operating in is North Dakota. We serve over 270,000 children that have experienced neglect or abuse that are mostly in the foster care system. And we serve those children through volunteer advocacy. We have a network of 93,000 volunteer advocates that are a part of or sworn in and authorized to operate through court systems across the country. And those volunteers work with youth that have experienced this trauma, neglect, and abuse, and they are advocating for their best interests. They're getting close to the families. They're understanding the dynamics and the situation and the lives of those children. They're working with school systems. They're working with teachers. They're working with medical providers. They're working with community leaders to really understand the situation in which the abuse and neglect occurred, but also looking for solutions so those children can be reunified with their families if they are removed. If they're not removed, we work with families to strengthen that safety net for those families. And when they are removed, and if reunification is not an option, then we are looking to ensure permanency, living relationships with, or living arrangements with their families, or arrangements with other kin or close family, not necessarily fictive kin, I would say. And if that's not possible, then it is adoption. We want children to have a safe and loving home, and that is the outcome that we look for those children.
So you're talking about the expertise of being a person who cares.
Yes.
Who observes life. But this isn't something that you're going to necessarily acquire through a particular schooling or a particular profession.
Yes.
Right? This really goes to the heart of just being a person, being an American who cares about other children who are like you, perhaps of a different race, perhaps of a different background, perhaps of a different circumstance, but we're using as adults, we're being a family, right? We're being a family in the United States. So Barnaby, your organization is a downstream organization from that first identification of a child that might have a need, and then you take it from there. Could you talk a little bit about how you face this issue from your perspective over in Los Angeles.
Sure. Yeah. So we work directly with the County of Los Angeles, who has identified children who are at risk, who have suffered abuse, neglect, and have been removed from their homes. So what we do is recruit, train, and all importantly, support the foster parents who are taking care of those children until such a time as their families of origin can be reunified with them. As Tara said, if that can't happen, then our families are open to adopting the children and providing that permanency, love, and support throughout their lives. So we are really a first responder and a safety net for kids who don't have other people in their lives who can take care of them once they've been separated from their families. We've been around for about 25 plus years, as I said, serving LA County and supporting the children and the families who care for them.
Could you give us a little bit of an overview of the scale of your operations? How many foster care parents are there in your network? How
Sure.
many staff, what your budget is?
Sure. We are considered a smaller organization in that we have about 22 people on staff, but a larger sort of piece of the puzzle. We have about 135 foster parents on our roster. We serve about 200 children a year. You asked about our budget. We have a budget of about $3.5 million. We also have a program that serves youth who are aging out of the system, 16 to 26-year-olds, and providing support and resources and services for those youth as they try and transition to adulthood and self-sufficiency.
So one of the things that we love talking about on this show are the different elements of a continuum. Larry, your organization falls between in scale, National CASA, and Barnaby's organization. Could you talk about how things are going in Florida and how your operation functions?
Sure, I'd love to. And you're right, we're sort of in between in scale. Childnet, technically in Florida statute, we are the lead agency for community-based care. And we serve that function both in Broward County, the Fort Lauderdale area, and in Palm Beach County, the area of West Palm Beach and the town of Palm Beach and the Glades. What we do is we actually manage the entire foster care system in both of those counties. So we are contracted by the state of Florida, its Department of Children and Families, to do the work that they 20 years ago once did from on high in Tallahassee. The model in Florida is to have organizations like ours. There are now 17 of us around the state, and we are all nonprofit organizations that craft a local system of care for foster children based on our community's local needs and on our local resources. So it's an incredibly interesting system. I think it's an incredibly effective system. Right now between Broward and Palm Beach, we are serving about 3,400 children today. That census is a little bit lower than it's historically been, but primarily for good reasons, as maybe I'll get a chance to explain. And between the two communities, we have contracts worth about $110 million.
One of the things that I find to be so interesting is that if you take your experiences, and I was in New York, and I was with the Child Welfare Administration at the time, which is now called ACS, and we coordinated work across all these independent nonprofit agencies. But if you take all these different organizations in different parts of the country, different politics in those different parts, different demographics in each of those parts, you are doing a lot of things that are very, very consistent across your different functions, right? Small organization, mid-sized organization, large organization. There's really a continuum of care here. Tara, as you look at trying to partner with people like Larry, people like Barnaby and so many others, I mean, you're talking about 270,000 children, you're talking about 93, I guess, 1,000 advocates. Is that what you said?
Correct. Yes.
Right. So you're partnering all over the place. So are you finding that there's a difference in how you can partner with different communities based in red state, blue state, the political stuff, or is that just nonsense when it comes to children and you just serve children?
We just serve children. And I think that's the thing that the three of us hold in common. We are all working to ensure that children are safe and children are given an opportunity in life to thrive. And foster families, obviously that is a huge need and a great intersection for our work. Our advocates work very closely with foster families to, again, continue to understand the experiences of the children that the foster parents are caring for. During the pandemic, obviously foster care was having more foster homes for children was of great concern for us as CASA advocates and as an organization. So those relationships are important. Relationships with the administration, as you talked about your past history in New York. We couldn't do our work. We're in close partnership with social workers, and we do our work in the court system. So that judicial support and that judicial relationship is also key to the work that we do. And so we're partnering with organizations like the two on this panel, as well as organizations that are focused on adoption and those organizations that are focused on strengthening families, because we want children to be with their families of origin. We believe that outcomes are better when that can happen. And I think we all work to that end.
So we just finished a poll, and we were trying to get to the primary reason that attendees felt children suffered trauma, with 61% of respondents responding that basically it was adults. Abuse and neglect by adults against children, in their view. And then the second most was lack of safety. And the third was physical and mental health care. As you take a look at your young people, Barnaby, how do you view the solution to this? Or is it just a process? Is it always going to be a fact of our life that certain children are going to find themselves in need of support from people who are not their families, perhaps with the intention of reunifying families, as Tara describes, or moving to a different circumstance, independent living or adoption, if that just isn't feasible? How do you see this developing in our society and healing?
That's a really big question, Mark. I think I'll use a word that we've so often heard over the last few years, which is, I think it's an intersection of all those things. Unfortunately, I think there will be children who will need assistance from outside their families of origin because of upstream issues like poverty, like lack of education, like domestic violence, like addiction, and those issues that are affecting adults who are trying to be full and whole adults while also parenting is difficult. And we need to provide those services to people across all of those situations. So I think that children will always need help. They will always, they are, due to no fault of their own, in the situation when we come in contact with them. And our job is just to provide everything we can to give them stability and safety and an opportunity to thrive. The primary goal is always to reunify them with their families if that's possible, and provide those families the support that they need. Adoption is something I think that we all celebrate, but we have to understand that that's a situation where one family's coming apart and another family's coming together. So understanding, both of those realms and providing the support, love, and really understanding and nurturance to across the spectrum, all the adults who are trying to care for these children.
So you're saying basically that the state of our child is really a reflection of the state of our society, right? If we have a healthy society, then children are less impacted. But when we find that so many children are impacted, we can look at that and we can say, we need to work more. As we come out of this pandemic and as we reopen schools, Larry, are you anticipating some negative effects? Sid Gardner asked the question where, do we expect a surge in child abuse neglect reports as we turn to school, or as parents are out there trying to figure out how to make an income Are we seeing an effect in your work in Florida?
One of the astounding things of the pandemic and its effect on child welfare in Florida is we really haven't seen an impact that everybody anticipated. Our numbers have essentially stayed consistent with what they were, with some exceptions. Clearly, abuse reports are down because with schools closed or only partially open, schools are traditionally the largest reporters of child abuse. So reports are definitely down. We are on the edge of getting backed up so that because of court hearings being slowed down and things of that sort, children are not necessarily moving through the system as rapidly as they normally would and moving to permanence as timely as we would like them. But overall, we have not seen some of the things we feared, which was a total loss of capacity in terms of being able to provide foster homes and residential care for children. We've survived a couple of crises, but so far, nothing that's overwhelmed the system, and we thought we were going to face that. And we haven't seen a drop in actual cases coming in. I think, strangely enough, because there's been some advantages to the pandemic in terms of the way we do business. Childnet, for example, we do dependency case management in both counties, and Florida law mandates that you visit foster children once a month. In the pandemic, while we may not be doing face-to-face visits as much as we did because the feds have given us a little bit of leeway, Childnet immediately, once we went to video conferencing, we began seeing children once a week. And so our eyes are on the children actually more than they had been, and we're actually interacting with their caregivers more than we had been. So everything's sort of balancing out in terms of those numbers. If I could take one more second to answer a question, or maybe your poll question, I want to be sure people understood. I don't know if it's unique to Florida. I doubt that it is, but the single, far and away, indisputable reason that children enter foster care in the state of Florida is their parents' substance use and abuse. At least 50% of the children that get removed, the primary reason for their removal is their parents' substance abuse, and I would surmise that in the other 50%, at least half of them, substance abuse is part of the issue.
So it's self-medication, perhaps in response to trauma, perhaps because people are irresponsible, but it is this idea of parents no longer being capable of acting in the interests of children and needing some intercession. Is that correct?
It is, but I would suggest that we would have, across the country, we would have adequate resources to care for children who have been traumatized the way we need to, which is far better than we currently do, if we could get on top of adult substance abuse.
We just completed a poll in which we asked whether particular regions are dedicating enough to children in need, and 95% of the respondents said no. Now, of course, this is an audience of people who have interest in this. But, what really strikes me is that this is really where our tax dollars are going, right? We are funding the government, and the government, local, state, national government, is funding you. Plus, you're doing fundraising all the time in order to get some additional contributions because the government funding is simply insufficient. How do we as a society respond appropriately? Because we always hear these complaints about taxes and government and all these different aspects. And then we are constantly bombarded by solicitations. It's an unfair question, Tara, but how do you respond to this? Because the need is so much there. If a child is in front of us and that child is hungry, we can see it and we can respond to it. But so often we sort of turn away when it comes to systemically responding in a way that funds these programs adequately.
Thank you for that question. I may not answer your question directly, but I want to answer in a way that is maybe that resonates with me a little more. I think when we talk about neglect and abuse, one of the primary issues, I think, across the country is poverty. And I think if we think about economic instability and insecurities of families, we're going to see more families that are disrupted. We're going to see more children come into care, and we don't know what life will be like or the economy will be like after the pandemic. But when I start to hear those debates about tax dollars going to child welfare and these services, and then I start to hear other conversations on, and not to get political here, I'm not trying to do that, but on, $15 minimum wage and not, wanting to have a $15 minimum wage. What families do you know that could survive on a $15 minimum wage, if we're just honest, or where a minimum wage is now? And families are suffering. And during emergencies and pandemics and situations, crises like this, it's always the most vulnerable who are hit the hardest. And our attention seems to go to that population last. We start to, and we should know that they're going to be the ones that are hit the hardest. So I think that it is a huge problem. And I think the need is going to be greater to stabilize those families. If we think about children staying with their families of origin, which is a lot less expensive if we can support those families than putting them into a system that our tax dollars are, that the government has to support. So that's may not be answering your question, but that's the thing that just really plays over and over again in my head that I can't seem to reconcile.
It's such a very good point, and it does address the topic, not in the way the question was asked, but sometimes the better answer is to answer the real issue. Andrea, for example, mentioned the whole issue of mental health services, right?
Yes.
And inadequate mental health services, which very often is tied to Larry's point with addiction, right? That creates downstream effects. So in a sense, by not investing in one place, we get an effect at the another place. So Barnaby, you're also nodding. You're having that same issue, right, amongst the people that you serve.
Absolutely. And just having also our youth program, a lot of our youth are parenting youth, and we see that these issues are systemic. Some of our youth children have ended up in foster care. So we really have to be tackling these issues ahead of where they come to us. As Tara said, poverty is a huge issue, and with poverty comes all that other slew of conditions that bring kids into care and create the conditions that create youth who are aging out, who never found permanency, who are then repeating the conditions that happened to them as children. So, there are a lot of supports that we're doing. There's a lot of education that we're doing. I want to kind of give a positive element here, that there are a lot of great minds and efforts and organizations working together, like the three of us here today, who are trying to really turn that ship. And I would love to be worked out of business and not have to be here. So a lot of our work is supporting the birth parents and the foster parents, to give them the resources to help us get worked out of business.
Well, it's such a good point. It's something that we talked about all four of us before the show started, about how do you care for the caregivers. Larry, could you just talk a little bit about how you create community and how you interact with your families, with the volunteers, and so on? And Tara, if you could also jump in, how do you ensure that people who are trying to deal with childhood trauma, who themselves are absorbing quite a bit of trauma, it's a first responders issue, how do you ensure that their needs are also being met?
Well, it's a really good question. And the Florida model, community-based care is what the foster care system in Florida is called. It is all about the relationships with organizations like Tara's and organizations like Barnaby's, their Florida branches or Florida counterparts. But it is also about creating a sense of community among caregivers. It is so Childnet, the model is we don't necessarily recruit and support foster parents, but we subcontract with 21 different agencies that actually license, train, and support foster parents. And support means that they really they create peer support groups among their foster parents. They create a community of foster parents. What foster parents look like today in the state of Florida, and compared to 20 years ago when Childnet started, is sort of like night and day. They are incredible people, but they do get incredible support from those, we call them child placing agencies, that recruit, train, license, and continue to support them. It's Childnet's responsibility to do everything we can in terms of the way we reimburse them to support that and make it possible. But then they also do an incredible job, some of them, including some of our faith-based organizations, of getting tremendous donations, tremendous fundraising. I don't think, frankly, that a single one of our subcontractors that we pay them the full cost of what they do. The really good ones make it up with incredible community support and donations, which is a model I have mixed feelings about because some of them are not as skilled at fundraising as others.
Well, and we just finished our third poll, and we asked what the primary method for paying for services to children in need. 77% felt that it was through government. And then there were a few other respondents. Tara, we're coming to the end of our time, so we're going to come to you, and then Barnaby, we're going to give you the last word. When we take a look at this whole system, and we're talking about easy points of entry, where you can make a real contribution, but not necessarily yet the commitment as a foster care parent, or even more of an adoptive parent. Is the point of entry to take our skills and place them in service to youth? Is the point of entry being a CASA GAL representative, a volunteer?
Thank you for that question. Absolutely. It is a great way for anyone that has an interest in supporting children, the most vulnerable of our children, to get involved. There's training, quite a bit of training. You have to have a heart for this. You have to be committed to this. You are that stable, consistent voice in the life of the child. Sometimes you're that only consistent voice, adult voice in that life. So that is a great way to involve yourselves in the child welfare system. But more importantly, it's a great way to make a difference in the lives of children.
And how long, what kind of a commitment? Let's say I were to come in, I get training. So there's a commitment for training, and then I get my assignments.
Yes, there's 30 hours of training. There's an extensive qualification background check process, screening process for our volunteers. And then there's 30 hours of what we call pre-service training. And then there's an additional requirement of 12 hours of training annually. And then the time that you spend with the volunteer, the time that you spend in the courtroom, the time you spend with the child, the time that you spend in the courtroom, and then the time that you spend getting to know the circumstances. So it is quite a commitment, and I don't shy away from that. It is not it's not episodic. It's not something you can get into and out of. And we ask that our volunteers commit to a child, and they remain with that child in that case as long as that case is a part of the system. And so it's a tough assignment, but I tell you, I hear this all the time. People get involved and they say, I want to make a difference in the lives of children, and they end up having the difference made in their own lives.
So the people who serve are actually receiving.
Absolutely.
And Barnaby, you're nodding. I saw Larry, you smiling. Are you both in accord with that idea? Barnaby, you first, and then Larry.
Absolutely. We are an agency who sees a lot of cases go to adoption. So we have parents who come to us who are seeking to adopt, and sometimes it's not that child that they first parent whose case is going to adoption, and so there will be reunifications, and there's loss and grief with that for the foster parents. But sometimes this can happen 3 or 4 times, and it's beautiful. The child's parents we're able to take that child and be reunified and continue. And that's the goal. That's the primary goal. But it can be hard on the foster parents. And I've spoken to so many of our foster parents who do ultimately end up adopting, who say they would not have changed one thing, who, every child that came into their home provided such a beautiful experience, and that they were able to be there for them. And while some of them are so young, they might not remember it, they were there when nobody else could be there. And they impacted that child in a way that will forever be with them. It's a profoundly shifting sector that we're in. And I've been deeply moved by it, and continue to be so. And the children who have the privilege of meeting are just phenomenal. And I think that for me, there's this sort of acceptance of foster care. It's kind of a sleeper issue. We've just sort of absorbed it, and it's in the background. But these are our children. This is our community, and we do need to come together as a community to raise them. And every one of them has the ability to thrive and contribute and just be phenomenal in their communities. And sometimes I feel like that's forgotten. And I want to bring it to the front and say there's nothing wrong with a child in foster care. It's just that their conditions weren't such that they could be where they were, and that they need every opportunity for that stability. And we just have to come together to raise them.
And Larry, you endorse that with all the different communities across Florida. Take us out. If you wanted us to remember one thing about what we can do, what we Americans can do, what is that thing that we can remember and do?
Well, I'd like to see the whole paradigm, the whole view of foster care change, and that government not think about economy and thrift and return on investment, but recognize that these are children who have been removed from their families because of traumatic conditions, and we should be focused on doing everything the best that we possibly can for all of them. We should not be trying to scrimp and save and be economical. I'd love to see the picture in view change to that. Thanks for that opportunity.
Well, the question is, what is my return on investment in a lifetime of parenting my 2 children, right? We need to all adopt that for our children.
Yes.
Thank you so much for sharing that, Larry Rein, President and CEO of Childnet in Florida, Barnaby Murff, CEO of Extraordinary Families in Los Angeles, and Tara Perry, CEO of National CASA Association for Children. I hope everyone who is here becomes an advocate, becomes a foster care parent, and advocates for children. That's the Nonprofit Report. Thank you, guests, for being here. Thank you, attendees, and we'll see you next Tuesday. Take care.
Thank you.